Hi everyone, this is Ryan Hoyme, aka Massage Nerd, and today we have Claire Marie Miller.
Nice to meet you, Ryan.
So you're really known for like reflexology.
Yes. Yes, I have my own method of reflexology and my own charts.
Okay.
And
you're actually holding one here too.
well, actually, I'm holding two. I'm holding
okay.
one I like, which is mine. Excuse my own opinion.
Yep.
Okay.
Oh, that's gorgeous.
And what I like about mine is it's easier to read, and I believe it's more anatomically correct because I was an X-ray tech for 7 years. So this one also includes hands and includes the meridians. And the meridians are a precursor to reflexology. They are the foundation that really got reflexology to happen as zones. So this is one of the things that I have. But this is a commonly sold chart. And nothing against whoever made it personally, but when I look at that anatomically, it makes me crazy. Because if you see right here, you've got the solar plexus and you have the lungs below the solar plexus. So here's my solar plexus. If my lung were below it, I would have a perforated diaphragm and I would be in ICU. And then you have the large intestine way down here, way below the waistline, and I used to be, as an X-ray tech, do barium enemas, may not want to know details, and the colon is not down there. If it were down this low, I'd have a prolapsed colon. So this makes no sense to me. And if I were a student looking at this and I were trying to really say, okay, there's something to this reflexology stuff, I would look at this and go, I'm confused. And that's what started it for me, was I looked at all the charts and they didn't make sense. And so for, gosh, really 30 years, I have been designing and designing and designing and looking for clarity.
Yeah, I love how you actually got the organs and stuff like that too.
Yeah,
it's easier to see.
You can really see that.
Because you can just quick look glance at them, because a lot of them is like little circles and everything else. It's just kind of confusing.
Yeah,
definitely.
So that was my goal with integrative reflexology, is to make sense of it. And like everything in life, we start with ourselves. I was trying to make sense of it for me, because I know it works. It's amazing, absolutely amazing.
And do reflexologists concentrate a lot on the hands too then, or is it mostly the feet?
It's mostly the feet. It's mostly the feet because you're standing, because you have gravitational pull. The hands are a backup for the feet. So this is your spine in the hand reflexology. Well, when you look at the curve of the foot, that looks like the spine. This doesn't look like the spine. So with the hands, I definitely use a lot of the meridians because, again, the meridians begin or end at the nail beds. So I always look at that combination of effect.
Okay.
But the feet are really the most powerful.
And then some people do the ears too.
Ears, yes, and the ears there are different charts for ears as well too. They have the inverted fetus. This looks like your kidney, so it has that meridian component. Yep. Mildred Carter, she has the heart down here, which is very different than other charts. But having worked with cardiologists at Johns Hopkins, that's where one of the places I was an X-ray tech, they assess ear creases for heart disease.
Whoa.
So when I saw her chart, it made that connection for me, and I thought, so I use a combination of things for the ears, but it's very hard if you go to an acupuncturist. They're using a tiny needle or a little bead that they'll tape on there or a little staple. For our big hands to get in there and do that is difficult.
And then I heard sometimes when people have tons of earrings and everything else, does that affect, would you say?
We believe it does.
Okay.
We believe it does.
Okay.
And, there's no proof on that, but even people who've had all of that said it shifted their energy. Okay. And then they've taken them out and their energy has shifted back. So, although I have one young man who had a big piercing here, and this is the pineal gland, and he said it helped his manic depressive behavior. Wow. So piercings, like acupuncture, may actually benefit if you at least know what you're doing with it. Have some intention with it.
Then they can tweak it too in a way.
Yeah. Well, I'm having a rough day. So,
And with reflexology, do people usually on the table or those reflexology chairs?
Either is fine. I'm a massage therapist, and my whole style comes from a massage therapy approach to reflexology. So I tend to use the table because they really let go, but I take chairs when I'm doing promo things. It's lightweight, it's easy to carry, it's very comfortable. And what's also different about mine is I don't do one foot and then the other foot. I go back and forth. There's a rhythm of going back and forth, much like how you would walk.
Yep.
And how I started it was, why would I do half of your colon and show up later and do the other half. It just wouldn't make sense.
Yep.
So I treat the feet together as the whole body. And I don't do finger thumb walking. I never trained with Ingham. So I'm a, you know, a unique entity over here. And I use knuckles. I do use my thumb. I use the side of my hand. I use a fist. I use rocks.
Okay.
I love smooth rocks.
Save your hands too, definitely.
Saves your hands.
Yep.
And I use cream, which they don't usually use any application of cream or anything.
Yep.
So it feels more whole to me.
Do you ever perform it in the prone position at all then?
Not as much. You can do it, like I use it in the massage, so you can check their spine reflex, you know, that type of thing.
Yep.
But when you're prone, your sinuses are filling up. Your breathing isn't as full. So it's much more effective face up because you're there for a long time.
Yeah, exactly.
You know, about an hour.
And what do your classes entail then?
I have a 3-day certification, and so in those 3 days you learn the basic integrative reflexology, you know, start to finish, standalone session, you can charge for that. I then go over the 4 theory approach, which is what I also use, so I do structural alignment based on Ida Roth's work, you know, how you stand and the fascia will then affect that organ or that gland. I do the zones, but I have changed the zones from what was taught by Ingham. They do straight lines across, and mine have curved lines because I think the body curves. And then I do the meridians a lot. I really talk about how you put meridians together with reflexology, and you get a deeper picture, you get a better assessment, and tools. And then I use the proprioceptors. Your feet have all these amazing nerve endings on the bottom of your feet, and that's firing up to your spinal column, to your brain, flushing it, and then potentially stimulating that part of your body.
And then one of my clients way back in the day, he had one of his kidneys removed, and it was really tender in that area too and stuff, and it just shocked him. I said, that's the kidney region in your foot and stuff, and it's just like, he kind of startled him. I was like, it's like,
that you
it's like
feel
phantom limb pain in a way too, if you want to look at it that way and stuff. So
with organ removal, uterus, gallbladder, kidneys, you know, gallbladder and uterus being the most common, you sometimes feel just a hardness there. It'll feel like it's like all the adhesions from the surgery or not having a gland there. And then in Chinese medicine, you still have the meridian. So you would support that with that meridian.
And then how does trigger points tie into that? Because
well, trigger points are probably similar in that there is a reflex. You press a point and it reflexes to an area. But I've actually developed something called muscle reflexology with meridians.
Okay.
So as you look at the feet, you can actually access muscles, and that connects in with meridians. So when you think of a muscle connected with a meridian, then you start to see trigger point might have a piece of that too. I mean, everything interrelates in our business.
Yeah, there's so much out there too.
It only increases, and I've been doing this 32 years. So.
So I'm not going to guess your age then.
Oh, I don't care.
No.
I made it this far. I'm proud of my age. I like being an old lady. I can just flop it down. I'm 56. I started in X-ray at 17.
Wow.
Yeah, did 7 years there, and I went to massage school in 1979 at the Boulder School of Massage Therapy, 1,000 hours.
Well, back then it was.
Back then it was 1,000 hours. Yeah, I got blessed.
Yeah, and that's nationally known too. And stuff. That's cool. So.
And that's where I first took reflexology. And then I moved to Lake Tahoe, and I was in my own little world having children and living up in the beautiful mountains and developing this style of reflexology, which I had no idea it would become an actual method.
No, some people, I mean, is zone therapy something totally different than what you
No,
say?
zone therapy is Ingham based.
Okay.
Zone therapy is, again, finger thumb walking, you're following a zone.
Okay.
My theory on the zones came out of the late 1800s with Dr. Bressler, but he credits the ancient oriental energy pathways as a precursor to zones. So when you look at the Western mind, we want it linear. You know, we set our cities down there, we live on a grid, it's all about that. When you look at the Asian model, it's circular.
Okay.
So the meridians do this. You know, they move around. So for the Western mind, that doesn't compute. So back then, to simplify it, they used the zones.
Okay.
So it does have a meridian, because most people with reflexology say it's energy work. Well, what is chi? It's energy moving through a pathway. Zones would say it's energy moving through that zone.
Okay.
So it has a piece of it, but it's not the whole story.
Okay.
I don't think. And I don't know that I have the whole story. It like everything.
It keeps evolving.
It keeps evolving,
Yeah,
absolutely.
definitely.
Yeah.
And any weird stories that you've had in the past and stuff like that that just shocked you at all with reflexology? Or
Boy.
yeah.
I've had some amazing ones. I have a sad one. This was really profound. I worked with a young man who, they were my printers, and their son passed away from cancer at 14.
Oh.
And so I worked with him a lot through that whole journey. But as he was nearing that time of leaving, and he wasn't making any sense, he was kind of out of it. The fluids had built up in his body, and he's at home. I come over. I start to work on the kidney, ureter, bladder, and he had not peed for 48 hours.
Oh.
And immediately he asked for a urinal. So I left the room, his dad, and he took care of that. And then he started to become more present. And then I was working the digestive system and the lungs, and he goes, I'm having pain here. Well, that's lung 1. So I started doing some lung work here, some lung work on his feet, and a nurse is sitting right next to me, and she goes, he's breathing on his own. His oxygen levels are changing as I'm sitting here watching this. So he starts breathing, coughing up some mucus. He becomes alert. He becomes hungry. I went home and got some peaches that I'd gotten from South Carolina and brought him back. He's playing on the computer. He's laughing. I mean, they thought he was going to die any minute when I walked in.
Oh.
He passed away 2 days later. But his whole family says every time they see me, we had that night with him.
Yep.
I've seen it for the uterus point. You work the uterus point for women in labor. They're getting contractions. You can watch it on a monitor. You stop working it, contractions stop. You go back, you work that uterus point, she gets contractions.
That's cool.
So it won't always make the baby come faster or sooner, but it does the job of getting the uterus to contract.
And with reflexology points, when they say first or second trimester, do people still think that you should stay away from those areas, or?
Well, yeah, there's a lot of misconceptions, We all err on the side of caution. We think, oh,
Yep.
don't do that because something might happen. The reality is, if that baby's not ready to come, it's okay to work, it will happen. I had one lady, I worked her a month before the baby got here. It's hot, it's July, get that baby out. Come on, Claire, you can do it. And she gets contractions, and we thought it would go. And 2 weeks later, she calls me, working it again, there's a full moon, I'm sure this will do it. Took 2 more weeks, and he came out perfect size. But when I went and worked on her at the birth center in our area, she had the baby 4 hours after I massaged her.
Oh, cool.
Completely natural.
And do you see hospitals actually using reflexology?
I've had nurses do in-service with me and use it. Again, and some of them will use it with cancer therapy because of the endorphins. Again, all those nerve endings, when you stimulate it, and that's why people love to have their feet worked on, they get an endorphin flush in their brain. And so that's actually excellent for pain relief.
And it's treating both your souls, right? Yeah.
You got it. It's a good pun, but I do soul work.
But do you heal them?
I believe that one. You facilitate their bodies, and that's the healing of bodies. And we never diagnose. We go, oh, you got something going on here. And every client goes, oh, what's going on there? What's wrong with me? I go, well, tell me your family history. Have you had any of this lately? You sort of use it as like a detective. And that's what I think is fun. And things show up and they go, wow, how'd you know that? I go, well, I'm really psychic. Did I know I'm charging $10 more for that?
Yeah. Upsell. So you teach classes all over?
I teach all over. I have a home study course in the integrative 3-day, so people can't get to me. I have other teachers I've trained to teach it. I love to come other places and teach. I'm still trying to make it happen in Alaska. Anybody from Alaska? I go to Montana. I go to Nebraska. I'm mostly in the southeast because I do like to drive.
Okay.
I don't really like those planes that much.
Okay. Okay. And the best way to get a hold of you for
ClaireMurrayMiller.com.
Okay. Perfect.
Yeah.
Okay. Thanks.
Thank you.
Thanks, everyone.
Thank you.